a great day, Medical Monday. It's at epidemic levels and is one of our nation's #1 killers. Our next doctor is reversing that trend without surgery or medicine. Here to tell us what that killer is and how we can add years back to our life. Welcome back, Dr. Reddy from Reddy Cardiac Wellness. Hi. All right, we're going to meet one of your patients in a minute who lost an incredible 60 pounds in 6 weeks. But first, let's talk about what is that killer.
The killer is diabetes. In fact, by 2020, there are predictions saying that more than 50% of all Americans will have obesity and diabetes.
More than 50%?
50%.
Wow.
So 1 in 2 in the next 8 years.
Yeah, and we say over and over again that this is the first generation of children that is not expected to live as long as their parents because of type 2 diabetes. One out of every 3 kids born since 2000 will be a diabetic. And we're seeing it, we used to call this type 2, which I want to make sure we differentiate between type 1 and type 2. We used to call type 2 adult onset.
That is correct. It's no more adult onset. Kids as young as 8, 10, 12, 14 are developing adult onset diabetes.
Yeah.
So the second thing is diabetes is the mother of all diseases.
Yeah, you as a cardiologist said, I'm going to treat diabetes because as a cardiologist, I know that type 2 diabetics will eventually get heart disease, many of them.
Vascular disease, problems with their legs, impotence, all the problems that come along with diabetes are also involving the vascular part. So
yeah, because you wanted to go ahead and address it, you want to be preventive.
The whole idea is to prevent it. And you can easily prevent it if you learn about diet and change the diet.
Right.
You can stop the progression if you learn about diet and change the diet. The issue is, when are you going to wake up and start learning about diet?
Yeah, and now here's the part that a lot of us still have a hard time believing. When someone is diagnosed with type 2 diabetes, you know, serious disease is kind of an umbrella over all these things that you talked about, blindness and amputations, all that stuff that's going to happen down the road. It's hard for us to believe that it's not about the insulin or the medicines that we can take. Instead, it is about the food that we eat. It's
all about the food. If you treat food like medication, and if you learn how to use your grocery store as your pharmacy, why would you have a problem?
Yeah, and you would always say these things, and people kept saying, wait a minute, what? They want to write it down. You did write it all down. It's in the book, Eat This, Lose That. And one of the things in there, I said before the break, about eating bread. Now, when you say bread, people go, oh, no, that's not going to work. But it's a specific type of bread that you formulated to help people when they start this diet plan.
It's called Reddy bread, for the lack of a better name. And it's made from soy and flax, and basically it's a very low-carb bread. And patients who have gone on this bread have lost weight. Some of them lost up to 100 pounds, and patients have been able to drop their medications if they follow the diet along with the bread.
Right, right. And that bread, what it helps to do is kind of reduce our cravings for carbs?
Yes, and it's also gluten-free.
Okay. All right. So let's take a look at Dr. Reddy's patient, Ron. This is Ron Lee's before he started the Reddy diet. Doesn't look like a happy man right there. But let's see what Ron looks like today, just 6 weeks after starting that Reddy bread diet. Wow. Wow, wow, wow. What a difference. You even have a smile on your face. You look brighter. You were kind of that typical type 2 diabetic going downhill fast.
Very fast.
What types of things were you dealing with that were all related to the weight and the diabetes?
Overweight.
Yeah.
Miserable. I didn't want to do anything.
It really was a slow death that you were looking at.
Basically, if you look at his problems, he had a weak heart, he had an abnormal rhythm, he had fatigue, he had shortness of breath on exertion every time he walked. His legs were swollen. He had neuropathy. He had ulcers on his foot.
Yes, and those ulcers wouldn't heal, would they? And of course, the reason why they wouldn't heal is if your circulation has been impacted by that diabetes.
Yes, the diabetes decreases immunity, and when your immunity is down, infection tends to spread faster. And he also had diabetes, which is out of control. He had high blood pressure. With all these things, and he was on multiple medications.
Yeah, and here's the key right here. You were taking all these medications, but you weren't getting any better.
I was covering it up.
You're covering up. And so that's the thing that you also want people to understand, Dr. Reddy, is that I can't tell you how many people will say, well, I'm now taking my insulin, so now I can eat what I want. The medications really address some symptoms, maybe, but they're not taking care of the root cause.
Right, you come back to the primary issue. Are you treating the cause, or are you treating the symptom? And every medication you take is to treat the symptom, not the cause. And the cause is what? Diet. If you change the diet, everything falls in place. And that's exactly what happened to him.
Ron, you were taking how many pills a day?
14 prescriptions.
14 prescriptions. You took 14 prescriptions a day.
And yet he was obese and miserable.
All right, so when you heard about this diet, did you think that it would work simply through food, or were you just that desperate to try anything?
No, my son goes to Dr. Reddy, and he recommended it.
Okay. And then you started seeing the weight come off.
Oh, yes.
And 60 pounds in 6 weeks. That's incredible.
The first day when he came to the office, he sat in the office for 4 hours. We have a diet program where we teach patients what to eat and what not to eat. He and his wife sat down, learned everything about food, and the very next day they started it. And he lost a lot of water weight. He also lost a lot of weight from his fat, and his heart function improved. His kidney function improved.
In 6 weeks?
In 6 weeks. His wound in the leg healed within a week, and the doctor was shocked. He said he's never seen a wound heal that fast, which was taking him a long time. His wife was getting tired changing the bandages. Now everything's healed.
That says a couple of things to me. One is our body is very forgiving because it'll put up with a beating for us for a long time, but you have to make the change. And when we say the diet and the food, we're thinking, okay, you were eating cardboard over the last 6 weeks, right? But you know, people keep thinking, they look to you, they look at you, they say, oh, a diet like this, to lose that kind of weight, you have to. It is a strict diet maybe by some means, but all the food on there you recognize. It's all real food.
What did I say? Everything you eat is available in a grocery store. That's all.
Yeah.
I'm not talking about any vitamins, nutrients, minerals, antioxidants, or medications. All he did was go to his local grocery store, buy the foods I asked him to buy.
Real foods.
Real foods. Ready
avocados,
bread. Ready bread. And eat 3 to 4 times a day.
And
as
real
per the
meat.
plan.
You can eat meat. You can eat lean meat.
As per the plan. Portions don't matter. Calories don't matter. Cholesterol doesn't matter. Frequency doesn't matter. Just follow the protocol. That's all. Eat to your stomach's content or heart's content, whatever you want to do.
As a cardiologist, you love when people exercise, but this is not mandatory with this program right here.
In fact, we never talked about exercise. We just talked about diet, and these are the results we've seen in less than 6 weeks.
Yeah.
I'm not an exerciser.
Yeah. When he came in, and I know it's hard to predict this with accuracy, but when he came in, how much more time were you giving him if you had to guess for life?
Well, I mean, if it didn't change, it was only a few months to a year.
Ron, you're going to say something?
That long.
You said about that long, and now what he essentially has done is added years to his life.
That's correct, because look, he's off his medication for diabetes, off his medication for blood pressure, he's lost weight, he's sleeping better, his attitude has changed, his cravings are gone, his wounds have healed, his personality is improved, he's happier, wakes up happy, doesn't wake up miserable and grumpy, and his wife is ecstatic.
Well, there you go. And that's all we need. For more information or how to get a copy of Dr. Reddy's book, you can call Reddy Cardiac Wellness at this number, 281-491-0044, 281-491-0044, or visit reddycardiology.com or reddybread.com.
And he's saving money.
And he's saving money because he's not spending money on all those prescriptions. And, of course, all those pills, there's no more side effects from those pills and the whole bit. So it goes on and on and on, domino effect. Thank you. Well, sleep is very valuable, and for many of us, it's underestimated. For some, they are just dreaming of getting more sleep. Find out how you can breathe better next.